what is NF? Well, NF is a genetic disorder that can cause a multitude of problems, from brain tumors to losing limbs on your body, to not being able to walk, to learning disabilities, to cancer. And it affects everybody differently.
NF1, the most common form, is characterized by cafe au lait spots and neurofibromas on or under the skin. NF1 is also characterized by the enlargement or deformation of bones, as well as tumors in the brain, cranial nerves, or the spinal cord. NF2, the second form in rarity, is characterized by tumors on the cranial and spinal nerves, as well as lesions on the brain and spinal cord. Hearing loss due to tumors affecting auditory nerves, usually occurs in the teens or early 20s, is generally the first symptom. Schwannomatosis is the rarest form of NF. It's not well understood because of how much the features vary between individuals.
It's affected 1 in every 3,000 people that are born. So it's fairly common, although when Riley was diagnosed at 6 months old, I had never heard of it before, and most people that we meet have never heard of it before. So it's something that we need to spread the word and get more research to find a cure. We've known people with NF and they've had it their whole life and they haven't had a problem. And then we know people that are younger than Riley that are having to go through chemotherapy. Riley had to do the same thing when she was younger. Right now we follow so many kids with NF and they all have a different story. Every single story is different. They either have brain tumors that are either on their optic nerve like Riley, or they're on their brainstem, and that can cause a lot of different problems with not only speech and walking, but their cognitive ability to realize what's going on.
MRIs and other diagnostic technologies are used to monitor the growth of tumors. Right now, there is no way to prevent the tumors from growing. Surgery can remove the tumors, and radiation as well as chemotherapy can be used, yet some doctors disagree on when it is or is not the right time to intervene on a tumor. For NF2, when tumors are small, they're easier to remove without damaging the auditory nerve. When tumors are larger, it's more difficult to preserve the auditory nerve. Medicines can help control or relieve the symptoms like headaches and seizures. Learning disabilities can be helped with detailed neurological exams or evaluations. For schwannomatosis, management of pain through medicine and surgery are the only treatments known at this time. Surgery is effective and may help the pain when the tumor is completely gone, but pain can come back with new tumors.
Well, our story is, Riley was 6 months old when she was diagnosed with NF1. And she was diagnosed because she has the cafe au lait spots. And they said everything was fine. We'd just do a routine MRI, make sure everything was okay, and that came back fine. And then a year later we did another one and they noticed that there was an optic glioma. So for years, we would just watch it. Something that can stay there forever and never affect her vision and have any problems. And it was doing just fine until you were 7. No, you were 6, almost 7. And it just decided to grow really, really fast. And they said we needed to save her eyesight. We needed to start chemotherapy. So we did, and it was 15 months of chemotherapy, and that changed our life. Changed our life forever. Most ways for the good, but some ways for the bad, because that's a childhood memory that she has being sick. But it made us realize that NF is serious. It's not just something that they told us that she has, and that we don't have to worry about. We have to think about it. We don't worry about it every day, but we think about it and we take it seriously. No. So it's been a year and a couple of months since she's been off chemotherapy, and she's been graduated up to every 6-month MRIs. So that means her tumor is stable, and they feel confident in that. So we're going to do that for a little while, and hopefully we'll get to a once-a-year MRIs, because that's the goal. That's the farthest we can get. And I'm hoping and praying that this is the only thing that she has to battle in her lifetime. But if she has to do another battle, it's all right. Been there, done that. We'll win that one too.